My name is Adrian Baddar. I'm an orthopedic surgeon at Hampton Roads Orthopedics and Sports Medicine. Today I'm going to be talking about partial knee replacements. This is a special kind of joint replacement that helps to fix part of your knee without addressing all of the knee, so it's not as extensive a surgery as a full knee replacement, which in a lot of times is very beneficial. This is indicated for patients who have developed arthritis in only one part of their knee. I tend to think of the knee as three compartments: inside, outside, and behind the kneecap. So if only one of those parts is worn out, you don't have to replace the entire knee when you can address the bad part. The typical arthritic pattern that people develop is to wear out just the medial side of the inside of their knee. That's the most common. And so we can address just that part if conservative measures are not working, i.e. medications, activity modification, physical therapy, injections, other modalities like that. So if it does come to surgery, partial knee replacement is an option. Okay, this is an example of a partial knee replacement that has been done on this poor model, where we have replaced the medial aspect of the end of the bone on both ends. A little bit of bone has been shaved away, and then metal caps have basically been fastened to the end of the bone. There's a little plastic spacer that goes in there, so you're not scraping away metal on metal, but have metal on a plastic articulation. When you do get arthritis and you've worn out the joint, you end up being bone on bone, and that's very painful because you have nerves in the bone. With this, those nerves are protected, so they're not scraping or rubbing against one another. Instead, you have the metal on plastic, so the bones are protected, and this knee can go back to feeling almost like your normal knee. I would say, in fact, that a partial knee is a lot more natural feeling than a full knee replacement. That's one of the benefits of it. Another obvious benefit of this is that this is 1/3 of the replacement, so it's 1/3 of the operation. The benefit of that is it's 1/3 of the recovery. In fact, people recover from this very quickly. The average procedure, it's about 45 minutes to an hour, so it's actually close to the length of time that it takes us to do a full knee replacement, but it's much less surgery to the patient. This is being done. Average patient could go home overnight, that night if they're healthy enough. Other people would spend the night, but almost everybody leaves the hospital within 24 hours of being there. The need for physical therapy is significantly reduced as well. Most patients actually don't even have a significant requirement for physical therapy. As long as they're getting up and moving, that can be good enough. Patients who need a little bit more, we can set up home health for them or even do outpatient therapy, but the grand majority really just don't even need it. With this implant, you can be up walking on it the day of surgery. It's fixed and ready to go as soon as we're done, so you can be fully weight bearing. Most people are on some kind of aid like a walker or crutches or a cane for a few days. We typically see people back around 10 days to 2 weeks. By that time, almost everybody is off an aid if they weren't using it beforehand, which is really nice. So no crutches, no walker, full weight bearing, and most people are walking very nicely at that point. No significant limp. Their motion comes back very quickly as well. In fact, I would say that most of the healing with this procedure is over in the first month. People get over this very quickly. This is not, again, like a full knee replacement that has a little bit more of an involved recovery in it. Again, because we're affecting a smaller portion of the joint, it's much more natural feeling, so it feels more like your joint. And so this is a great option if people are a candidate for it. Be a candidate for it, though, again, you really can only have arthritis in one part of the joint. We're not fixing behind the kneecap, we're not fixing the lateral side, so if you're having issues on those parts, you're not really a good candidate for that. You cannot have a lot of deformity, you cannot have a lot of other issues with the knee, you can't have ligament problems and things like that. Those are all things, though, that if we came in and evaluated you, we would look at and address and make sure that you are a perfect candidate for this if you're thinking about going forward with a partial knee replacement.